Hi, my name is Kari and this is my cardiac cycle oral report. First, we start out with the SA node generates an action potential, which allows calcium and sodium to enter and flow through gap junctions from one cell to the next. And we see this as a wave of depolarization into the atria. This wave can be seen and recorded on the ECG, which you see it as the P wave. And again, the atria contracts here. So it gets into the contractile cells of the atria, causing them to contract, and the increase of contraction leads them to increase atrial pressure. And this pressure rises in both the left and the right atria. So because we increase the left atrial pressure, the atrial pressure is greater than the ventricular pressure right now. So that means we move more blood into the ventricle, which tops off the ventricular filling. The wave of depolarization makes its way down the internodal pathways to the AV node, and the AV node has a bundle of autorhythmic cells, which is called the bundle of His. And the bundle of His connects the atrial side to the ventricular side, and this is the only pass of this potential from the atria to the ventricle, so it's very, very important. There's also a delay from the AV node to the ventricle, and it's about 0.12 seconds to 0.16 seconds, so it's actually pretty quick. But there is a slight delay there, which they call it the delay of conduction in the bundle. And we also see this on the ECG as the PR interval. So at this time, there are many gap junctions, so this process is really, really quick. Once it gets in the contractile cells, it is a slower wave of depolarization. And in this wave, we see it as the QRS complex, which is the big spike in the ECG. The action potential is conducted through this bundle and conducted through the left and the right bundle of branches and into the Purkinje fibers, which that also makes it go a lot quicker. And this causes a wave of depolarization in the ventricles again, which is the QRS complex. So this causes the ventricles to contract. And at the same time the ventricles contract, the atria repolarizes, which causes them to relax, and that causes the pressure to decrease. Ventricular pressure at this time also increases. Now the ventricular pressure is greater than the atrial pressure, which causes the atrial ventricular valves to close, the AV valves, and the snapping of those closed is the first heart sound that we hear. All the valves are closed now, no increase in volume, which this is called the isovolumetric contraction. Pressure keeps rising until the ventricular pressure is greater than the atrial pressure, which this causes the semilunar valve to open. And when the semilunar valve opens, ejection occurs, and so this forces the blood out of the ventricle, removing the stroke volume amount of blood. So once that happens, the T wave occurs in the ECG. And when the T wave occurs, it's the ventricular repolarization. And when I say repolarization, that means the ventricles relax and the ventricular pressure decreases. So now the ventricular pressure is less than the coronary artery pressure, which causes the semilunar valve to close. And the snapping of the second valve closing is the second heart sound that we always hear. So voltage-gated calcium channels are now inactivated. At this point, two things occur. One, it exposes the coronary artery entrance, which perfuses the coronary artery through the dicrotic notch. And two, the pressure drops, which causes the atrial pressure to be less than the ventricular pressure, and the ventricular pressure to be less than the coronary artery pressure. So at this time, all the valves are closed, and this is called isovolumetric relaxation. Now at this point, ventricular pressure is less than atrial pressure, which causes the AV valve to open again, and that causes ventricular filling. The amount of blood here is the end systolic volume. The amount of blood that we generated when the ventricles were filling up is the end diastolic volume. And there is an equation to express this, and it's end diastolic volume minus stroke volume equals end systolic volume. So at this point, the cycle is over, but since it's a cycle, it continues. So then the SA node now generates an action potential again to start the next cycle. And that is the end of my cardiac cycle oral report. Thank you.